All right, awesome. So I definitely wanted to just have an interview with you because I think the service that you provide are so helpful for people that are having challenges, and these are very emotional things to talk about.
Hmm.
So it's extra personal, and I feel like public therapy is like that too, where, if it's just like we can put it outside of us, if it's like our ankle is injured or my knee hurts or my shoulder has a problem, but then when we have issues in the middle, when we're having problems with bowel movements and sexual function and urinary function or pains in the lower abdomen and those kinds of things, people, it's like they feel like I'm broken, like I
Hmm.
don't work.
Absolutely.
I feel it's more and, internalized, like a part of me is not working right versus just like, I just don't communicate well. Or, it's
Hmm.
like something is wrong with me because I don't feel the way I think I should feel or things like that. I imagine with sex therapy might be kind of like that too. Um,
Hmm.
so tell me a little bit about yourself. I mean, I know you, but so for this interview, tell me a little bit about yourself and how you got started in mental health care, and then specifically how you chose to get more specialized in sex therapy.
Sure. So, mental health, I think one of the first classes I ever took as dual enrollment, I was all of like 14 years old when I took this class, was psychology. And I was just fascinated. I was like, wow, it's like there is this code book for unlocking, the secrets of the universe or something. It was so interesting to me. Of course, back then I was like, ooh, so I can figure all this out and then understand my family or my friends or whomever. But it was just always something I was really incredibly passionate about. I originally was actually a biology major, and then I just found all of my electives were going into psychology. And so I was like, oh, maybe there's something to this. Maybe I need to explore this a little bit more. So went to grad school at UCF, had a great time. And while I was there, just very much developed like a passion for working with parents specifically. There's so much that happens. I think so many identity shift. Like it's just such a unique time when people are in that, whether they're trying to get pregnant or pregnancy, postpartum. It's just like such a huge shift. So you get to see almost this grown-up developmental phase that happens. As people get to that. So I really, really had a passion of working with parents, working with couples. And after I'd done that for a number of years, I realized, hey, a big part not that we don't already know this, of working with couples is helping them with that, component, the physical intimacy and sex part. And so many people are, even providers, I'm sure you've seen this too, get very, very squeamish about any kind of parts, you know? So just
We've all been grown up in this society
where it's very
together,
taboo, it's
you
very,
know, and
and so
some
it
people
makes
more
it.
than others. Yeah, exactly. But definitely, we've, even if you study something, we still have all these things that we bring with us as humans that we've been taught and ways we're supposed to feel and all these kinds of things. So, providers are just people,
Mhm, exactly.
right?
Yeah. So they
And
bring that too, right? Our cultural norms, our
yes,
cultural taboos,
yes,
and
yeah, so
so
absolutely.
many of us weren't taught how to speak to clients or patients about those things either. So, we get squeamish, they definitely get squeamish, they're not going to bring that. But it's a huge part. And I personally think it's almost a quality of life issue if relationships are not having the kind of intimacy that they want when we have desire discrepancies or pain issues or anything like that. Like that is a huge part of connecting as a couple. Do I think it's the be all end all? No, but I do think, it's an important piece and it's very, very valuable to a lot of couples. And so when they struggle there, again, it's kind of like, who do we turn to? Who do we talk to about this? Not necessarily my PCP, not necessarily my regular therapist. So a lot of them are just kind of struggling in silence. And that really was something that didn't sit well with me. So I wanted for many, many years to pursue further training in sex therapy and um, originally applied like 2020 to my PhD program. And of course, like COVID hit right afterwards. So I was like, well, okay, so maybe this sits on the shelf a minute. And then a couple years back, went back, got board certified as a sex therapist. And I'm actually in kind of the final parts of that, finishing my dissertation, specifically on kind of sex after baby and how those physiological changes, how those, even emotional and mental changes impact couples. And I'm trying to develop essentially a curriculum for providers as well so that we
Oh,
can have
super.
those
Yeah.
talks.
Yeah. So important because, yeah, as providers, we have to take that extra time. Very important today
Yeah.
to to educate ourselves and learn what our feelings are about things so that we can let go of some of our personal ideas and really just learn how to listen to things about sex that, you know, we just sometimes have learned to feel we're supposed to feel uncomfortable about or we're supposed to feel a certain way about. So
Hmm.
that being able to have a nice conversation and listen to people and just be able to listen without all that stuff going on in our own
Sure.
heads at the same time lets them feel really comfortable and open to communicate with us as providers. And
Hmm.
we can ask questions. We don't have to wait for them to tell us everything. So that helps people feel like, oh, this is a normal thing that happens to people. They already know the questions to ask, you know.
Hmm.
And I think it's really important to take the time to do that if you're treating people that might be having issues. With intimacy and right, physical intimacy is a big part of how a lot of people connect with each other. So it's a big, it's a big one for sure.
I think
Um,
you hit on something so important too, Christine, as far as like the normalization, right? Because again, we talked about the taboos, we talked about, which always makes me laugh because we live in a society that sexualizes everything. Like every commercial you see, it could be, I don't even know, it could
yeah,
be like an
everything,
acne cream, and like suddenly,
everything,
there's some kind of sexy something. You're like, what is happening here? So we sexualize everything, but then we don't talk about any of this stuff,
no,
right?
yes.
Normal, healthy sexual functioning, everybody is like, ooh, nope, they get squeamish about. So, couples and individuals, when something like this happens, I feel like they can feel so isolated.
Hmm.
And just like, I'm the only person in the universe that's ever felt like this. And when we don't have those resources or don't know who to talk to about it, things that could be very, very treatable, I'm sure you see this too,
Hmm.
are never treated and they just struggle
No.
for years. And that breaks my heart. So,
No.
I
Sometimes
think,
couples are, or somebody is not even, they don't even know how to communicate to their partner that they have a physical pain.
mhm.
They don't want to hurt their partner's feelings, or they don't want their partner to feel rejected, or they just think it's normal because somewhere they got the message that, oh, um, it's no, it's not always this way, but it's like, oh yeah, women don't enjoy that, or women
Mhm,
have pain with that, or it's uncomfortable and that's just normal, or
mhm,
things they get some messages somewhere along their lifetime, possibly family members have had other kind of things and they bring it up to a mom or a sister or a grandma or aunt or something, and they're like, oh yeah, that's just that's just normal, or after you have kids that pain and or that problem is just normal, and so
mhm,
they just go, oh well, that's just the way I'm
mhm, just kind
supposed
of
to
accept
be,
it.
and I'm stuck this way forever. So why bother bringing it up?
Mhm.
Yeah.
I tell you, Christine, so I grew up in a family where my mom was very vocal, very open about things, and I appreciate that so much now. My own kids probably don't, that
Yeah,
I've
I'm pretty
carried on
sure
that
my kids are like,
tradition.
Mom, I do not,
Like,
too
please,
much
I'm good.
information,
I'm very
Mom.
educated in this space, Mom. I'm too educated.
Sorry.
But I tell you, like, it was such a like mind-blowing thing to me to realize that as silly as this is, that not everybody grows up in households like that, that there are households where there is no sex education at all. There is no kind of education about bodily functions, about what is normal, what's not normal, and people just kind of had to find it out as they went along. And so again, like realizing that into adulthood, you would think I would
Yes.
have, connected those dots earlier, like, oh, okay, everybody's mom wasn't like that. But it again kind of instilled that passion in me to want to educate people so they can make informed decisions, so that they can kind of seek treatment and be able to advocate for their own care in these spaces.
Yeah. So tell me, what are some of the myths or misunderstandings about what people think sex therapy is? Because not that I mean, I don't think it's this, but media has shown me something about what sex therapy is, like in like sitcoms or funny movies or things like that. It's usually a point of comedy.
Mm-hmm.
And and so the sex therapist is like, certain ways, present a certain way, or like one that's kind of funny but not too inappropriate is like the Meet the Fockers
That's
movie,
what I was just thinking
right?
when you were saying
There's some
that.
inappropriate ones. I don't want to, I don't want to mention this,
Hmm.
but sometimes it's like the sex therapist is like, doing sexy stuff with
Right.
people or whatever. It's like they're not a sex instructor,
Mhm.
like,
Yes, yes.
uh,
So we could, I guess, bust that myth right off the bat. You don't have
right.
to come in here and practice in front of me.
Right,
That's just not what this is about.
right, or the Meet the Fockers, right? It's like all this weird woo woo crazy stuff,
Mhm.
So tell me, some mess or what it's really like, in comparison.
Sure. I mean, the most general one, I think people assume like this has got to be so awkward, so embarrassing to go in and talk about these things. And oh my gosh, like how awful is that going to be, kind of thing, if we get to that point. Realistically, every client I've ever spoken to just discusses like this sense of relief, essentially. Like, oh my gosh, I haven't been carrying this around. I haven't been able to talk to anybody, not even my partner sometimes, and just that huge sense of relief. And I'm not alone in this. Other people have these experiences. And so, even that part, that it has to be embarrassing or uncomfortable. It's like, I'm not embarrassed. Arch. You would have to really come up with something exciting to shock me at this point. So, every time they're like, well, hold on, like this might be a little TMI. No, you're fine. Like this is old hat at this point.
Yeah, I definitely had
Another
that
one would
same
just
experience in here.
yeah, that if it comes down to needing sex therapy or seeking sex therapy, that something must be wrong with you or wrong with your relationship. And that like couldn't be further from the truth. It's so common to experience sexual issues, either individually or in a relationship. And a lot of times it's just centered around like major life transitions that might be happening, whether that's, trying to get pregnant, pregnancy, postpartum, whether that's we're with a new partner. Sometimes even like cultural context. I've left the church. I've, joined the church again. What does this mean around that? But it does not have to mean like everything is on fire and oh my gosh, we're in a bad spot. It's almost like a proactive thing for a lot of people. Like, hey, let's optimize this part of our life. Let's learn how to have these discussions if we didn't see those modeled in family or media or anything like that.
I love that. And do you always see a couple together, or do you see people as individuals sometimes or separately? How does that work?
That's a great question. So, yes, I see both couples and individuals. Sometimes the individuals will come in and talk in context of like, hey, I'm struggling in my partnership. Sometimes they come in and they say, hey, I have never by myself with anyone else experienced an orgasm, or, I've always had pain and I didn't realize that was abnormal until recently when I was talking to girlfriends or, what have you. So I've seen kind of both and am comfortable working in both spaces. I will say when people are in partnered relationships, a lot of times, if some of the struggle is there, we will incorporate their partner at some point at their level of comfortability. I realize that I'm just, I get a snapshot, so I get to share that space with them and help with education and kind of help with that emotional toll that might be happening, but it's such a small blip in the radar of their everyday life. So ideally, I want to equip them with the ability to communicate to their partner those things. And sometimes they feel a little bit safer to do that in the context of the office because they feel like, okay, I have this little safety net there. If I struggle, she can help me kind of, share what I'm trying to share. So I guess yes and yes. I see both.
So both ways, yeah. Or
Mhm.
they can start however they feel most comfortable reaching out, and you can help them guide them into what would be the most beneficial to them and what they feel good about. Okay.
And I think that's a great point too, because a big part of therapy in general, but also sex therapy, is I believe most people are the experts on them, right? They've lived their whole life in their mind and body. I have not. I have this, little bit of expertise, but I do defer to them as far as, okay, what is your level of comfortability? We're going to go at your pace with things. We're not going to come in the first day and you have to explicitly detail every sexual encounter you've ever had or anything like that. It's very much at their pace, their level of comfortability. And the goals are based on what they want. I'm not here to pathologize. I'm not here to say this is what's wrong with you. This is how many Hail Marys you need to do to fix it. It's very strength based. It's very proactive in the sense of like, you tell me what you want to work on, and that's what we're going to do.
Great. I love that. And sometimes I will see people with trauma histories that are affecting how they're recovering. It can be a major contributing factor to their pain, to their pelvic
Mhm.
pain, or it might just be another layer that is difficult for them to let go of their pelvic pain.
Mhm.
Is that something you feel comfortable helping people through?
Absolutely. So sometimes we use kind of adjunct therapies depending on what that trauma might look like. EMDR is a really, really effective tool that I use a lot here for kind of could be chronic trauma, it could be isolated incidents, sometimes if there's been sexual assault, or like history of molestation, anything like that. Like our nervous system remembers that. So even if we try to compartmentalize that and stuff it down in the far reaches of our brain, our nervous system remembers. And so then, even when we are in a safe kind of partnered relationship and we want to engage in physical intimacy, a lot of times nervous system is responding. It can cause pain. It's almost like we're trying to press the gas pedal but also the brake pedal at the same time because we've been conditioned that it's not safe. And so we have to kind of unpack that trauma sometimes to release it and store it appropriately, essentially, so that it's not still in our body.
And let me see, is there anything in particular that you want to share as far as things about your practice or information about sex therapy that I didn't ask you yet?
Well, you did a very thorough job, so very impressed, Christine. I would just say that one of my big things, I'm sure you've seen this too, your office is amazing. You kind of designed it with the same things in mind, I bet, is I went lots of different therapy practices myself, even as a client, like, okay, to see not just style, but and I had kind of a mixed feeling in a lot of places. It was either very sterile, very clinical, which personally made me feel kind of uncomfortable. Like it was just not where I want to be very vulnerable and open up. Or I don't know, it was like a hodgepodge of like felt like flea market
Somebody's living
furniture,
room, like
like
shabby
like
chic
the
living
old
room.
plastic on the couch or something. And
Right,
like
right.
I don't
Gotcha.
know.
Yeah.
All this to say that we've worked really hard here at Ohana Wellness Collective to like make it feel like home as soon as you walk in the doors. Like we want you to be comfortable. We want you to grab a coffee. read a book, do whatever, so that it sets the stage right from then. And then obviously all of our practitioners are amazing. I am very biased there, but I've also seen so many therapists. So I do know like they're so passionate about this work and, truly have a heart for helping clients. And so again, like any of these presenting issues are going to be given like such an attention to detail and compassion here.
I have not been in your new office, but I did.
No,
If
I want
anybody
you to
wants
come
to see
by.
what it looks like, you have a great video online with like a little tour of your office, and it looks beautiful. The new space looks great.
Oh, thank
You're very
you.
inviting. And I know that you're a lot like me. I'm so protective about my clients that
Mhm.
I would never have, like, you would never have somebody working in your practice that you didn't feel really comfortable
Oh, geez, no, no.
letting
They
somebody
laugh at
see.
me because I'm so slow to hire people. They're like, we need more people in here. I mean, I'm like,
I'm
listen, it's a vibe we're
I'm so
trying to maintain.
particular. I'm so protective of my people. I'm like, once you're my person, like you're like my person, like for, like forever. I care about you as a person. And so I'm very particular about the language that I use and the way that we speak to people. And so yeah, I can imagine that all of your therapists are really great. And I met one of your, I guess, an intern at a Central Florida Birth Network event, and she was really great.
Kendra, I think
So
Kendra was there.
yeah, so I'm sure everybody is wonderful. And then we just have a couple more minutes before our little interview is over. Tell us where to find you and like, where to follow your practice and find more information about you and schedule appointments.
Sure. So easiest way is probably just www.ohanacounselingandwellness.com. We're also on Instagram at Ohana Counseling and Wellness and Facebook. Sometimes we're kind of switching over our branding to Ohana Wellness Collective. So you might
Okay.
see more of that. We're the same people though. We do all the same things. We're just adding some more different classes and events and things like that. And we
Yeah, I'm
thought
looking
that kind
forward
of
to see
better.
how that space comes about. And I know you have different kind of providers coming in to share some space with you, and that will give people a lot of different options and services they can get all under one roof and meet different
Absolutely.
kind of
Yeah.
wellness providers. So that will be great. And space for classes and things, I think you said, is
We'll
on the
have to have
list.
you out here. I know you do some classes sometimes, so
I would
I'm
love to. I would love to. I love doing community education. It's one of the funnest things. And I can talk all day long about pelvic floor stuff. I know lots of people do get nervous talking in front of people, but I'm more like, okay, Christine, your time is up. Get off the stage now.
we get the shepherd's hook, we pull you
Yeah, they're
off.
like, okay, no. But what was I gonna say? Yeah, so I'm looking forward. I'm gonna be putting this interview. I'll edit some, make it look, some of my ums and ahs out of there and vice versa. Um,
Razzle dazzle.
but but for February, I'm gonna be releasing it during the month of February, just because there's so many people who feel this pressure during February with Valentine's Day, right? There's a lot of pressure to be intimate and sex comes up more, like there's a lot of expectations and like wondering how that's going to happen for a lot of couples. And so I have multiple videos that I'm doing. One is on just some of the more common reasons people have pain with sex, and then some tools and products available that people can get for themselves to help reduce pain with sex, this interview with you, so other providers in the community that, help with the same types of conditions.
Mhm.
And you mentioned earlier something that you do, and depending on the person, I will do with them too, is teach them some sensate work that's, not um
Penetration
penetration
focus.
related. We're
Everything
just
is
Just
like
learn, right? And I like to tell people, and I like to also change that to, right? I call it penetrative sex or not penetrative sex. It's not foreplay, it's just sex.
Hmm.
It's just a different kind of sex without a penis and a vagina or without something in a vagina. But it's not just an appetizer
Hmm.
for people. It's like,
It's
it's
true. Like we
actually
make
the,
it this very linear thing, and over
it's
time, I
not
feel
just,
like you fast forward through all that
yeah.
stuff anyway, and
Right.
then
We're
it's
not
just
just
the
doing the
sex.
one thing just so we can get to the other thing. Like the other
Hmm.
thing is other things, but also just not even non-sexual. So lots of people just even with this more of the sensate types of things that I teach people is even just people who are uncomfortable being touched at all,
Hmm.
learning how to be touched without feeling like with their nervous system being relaxed and learning how to feel what they're feeling and not feel the pressure, of what's going to happen next. You
Sure.
know. So I'm going to do a short video on that and other ways to be intimate or have intimacy, I should say, with your partner that's not sex related. So those are some things I think are great for the month of February.
Absolutely. I love that.
Yeah. Thank you so much for spending your time
Thank
with me
you.
today. I so appreciate it. And I love letting people know that you're out there for them to help them and that they'll be in great hands and really well taken care of. So thank you for
And
being in our
absolutely. Thank you
community.
for
You're
having
great.
me.